The U.S. Surgeon General is firing back at critics who say the federal government has given mixed signals about how best to stop the spread of COVID-19.
I was saying that then because everything we knew about coronaviruses before that point told us that people were not likely to spread when they were asymptomatic. That's what the science said, and I want the American people to understand we follow the science, and when we learn more, our recommendations change.
Okay.
All right, Andy, are you going to stop giving this man grief for what he said in March?
No, because that's not true.
Okay.
Because that's not true. I mean, that's a lie. That is a straight up lie, and that's fine. But the reason they said that, and we've reported on this extensively, so has CNN, is because there wasn't enough PPE to go around for everybody, and they didn't want the general public to do what we did with the toilet paper, which is buy all of it, so that we couldn't get it for the healthcare workers. Anyway, though, back in February, the federal government, including Jerome Adams, said the public did not need to wear face masks. Of course, that stance has changed. President Trump was seen wearing a mask during a visit to Walter Reed Medical Center in Maryland over the weekend. So, there's a lot of things we didn't know about this, right? It's changing all the time. That is true. You can't fault people for, I guess, trying to do their best. But his tweet on February 29th of this year was, seriously, people, stop buying masks, and all exclamation point. They're not effective in preventing general public from catching coronavirus. But if healthcare providers can't get them to care for sick patients, it puts them and our communities at risk. And the reason that this is important is not because it's wrong necessarily, even though it is, but it's also, it adds to this sort of, like, now we're at a point where, like, the stupidest outcome of this happened that could have possibly happened, which is that, like, we've politicized this so much that no one really believes the same thing. Some people, depending on the side that you're on, believe this versus that. We have ruined our ability to have real discourse around science and understand science and effectively get people on board to prevent this thing from spreading, because of this kind of bad messaging. And I don't know. I don't think it's forgivable.
But even if we rally around science, like what we're saying now, which I mean we should do, right? Because that's where the facts lie. But even if we were to do that, this thing is so new and dynamic and ever changing that if we rally around this science of today, a week from now, that science could have evolved and been like, well, no, that's actually going to affect us in the wrong or negatively.
Robert, I listened to a doctor say exactly that in a podcast today, saying that he used an expletive. He said, that is effing science. That is what science is. It evolves, you learn, you make decisions. I'm not saying that the Surgeon General was using the best science by telling people to not wear masks. I for sure think, and he has since said, that they were trying to prevent people from stocking up on PPE when it was needed for the healthcare workers. But I think both of you are saying the same thing, that we learn new things with this. It's called the novel coronavirus because it's new. It's a new virus, and we're learning how to deal with it. And that does include how to treat people better, which is what I mean. Death rates are dropping, which we should all be, instead of politicizing, we should all be praising, and that should be a good thing.
Yeah, absolutely. I don't disagree with you. And you're right, Robert. And that's why this has been so confusing. Remember, we wiped down our bananas famously.
Yeah.
And
are you going back to wiping your bananas?
No.
No, okay.
Stopped with the banana.
You're not making a sanitary line on the counter between groceries anymore.
Gave it up. Stop doing it. Don't care anymore. Because it's also like, and Barbara Ferrer reiterated this today. There, of course, was that outbreak of COVID-19 at a warehouse where they manufactured masks. And the question was, do we need to recall these masks? Could somebody get a mask or get the coronavirus rather from touching this mask? And she said, listen, no. This isn't the way that we think this is transferred. It's not from touching something, and it, the likelihood that something could have an active virus on it that could make it all the way through packing and packaging and transport to wherever you are getting it is very low. She said, still wash your stuff. It's important, but that's really not the way that most of this is spreading. And again, it's not because they were lying at the beginning. It's because they just didn't know. And I absolutely understand that. And I think that all of us are just sort of, we have to deal with that. Like you said, Sam, that's science. The problem is when it's so explicitly done in a way like Jerome Adams did in February that was duplicitous, to say the least, because of an ulterior motive. I think it just provides ammunition and fodder for people who don't want to do the thing that we should do for whatever reason. And that is why we are in this position, I think. One of the many reasons. But anyway,